have a look at our main news this morning, and it's all about health tourism, which has apparently left the NHS with a £200 million black hole.
Oh, another black hole, great. That's despite years of government pledges to crack down on abuse of the system.
Well, these new figures, which have been obtained by the Sunday Express, reveal that foreign nationals have racked up huge treatment bills over the last 5 years, and they think about £110,000 is lost to this every single day.
So, is this yet another example of soft touch Britain and a black hole that needs plugging in the government's finances?
Let's talk to political commentator Charlie Rowley. Charlie, good morning to you.
Charlie.
Good morning. I suppose if you think about it, we knew this sort of tourism was happening, but not to this extent.
I think that's absolutely right. And the idea that as part of this story also, that some institutions within the NHS, so whether it's a local commissioning group or whether it's an actual hospital, they fail to even invoice somebody that might have been in because they know that actually that invoice won't be paid. I mean, it's beggars belief. And for so long we've talked about it not being an international health service. It's a national health service. People who are here, that obviously hard work, work hard, pay their taxes. That's where the money goes. It goes onto the NHS, something that we can all rely upon, something that we want to keep and preserve for when we all get sick or when we all need to use it. But the idea that people literally come over as part of health tourism, use the NHS, and then, hop it back home.
But we all know...
It's on the taxpayer's buck.
But we all know when you pop into a hospital or whatever, they get on the system, they see who you are, etc. They should be able to see... If someone isn't eligible, they should be charged up front, shouldn't they?
Well, they should, but this is where I think the politics of running and maintaining the NHS comes in, because as soon as you ask the question, should you be asking who is it that's turns up at the front gates or the revolving doors of any kind of NHS hospital, then you're privatising it, because the whole point of the NHS is that it's free at the point of delivery, it's free at the point of use, and that should be for anybody that walks in through the door. So the idea that it's about money, the idea that it's about anything else should be second fiddle to just delivering healthcare. And I agree with that, but you have to be able to identify who those particular people are. And if they are just coming as health tourists, as this report claims to be, then of course they need to be charged. They need to pay the fee because it is not an international health service.
So it's another story where we're tiptoeing around the facts and damaging the National Health Service even further. And we know sort of like 7.2 million of us are still on the waiting list for appointments. To tiptoe around not being seen to be offensive to anybody. I mean, it's a really simple problem to solve. When someone comes into hospital, if you can't give your national insurance number and your details and your date of birth and all that sort of thing that they ask you, you hand your credit card over.
Using the internet without a VPN, a virtual private network, is a bit like taking to the road without car insurance. All it takes is one unlucky moment to cost you a lot of cash. This video's sponsor is Private Internet Access. They are the VPN to help keep you safe. Click the link in the description below to find out why over 30 million people have downloaded PIA to protect themselves online. A virtual private network is an app that hides your IP address and helps keep your data private. When you're browsing the internet at home, you give up a large amount of data to businesses, to shops, and indeed to social media giants too. Hackers have the ability to steal your personal data with ease, including sensitive information such as passwords, keystrokes, and even your personal photos. Private Internet Access helps protect your personal data by encrypting your internet connection to keep your data out of the hands of cyber criminals. And it's not just hackers either to be concerned about. Information can be censored too. When Canada passed their C-18 bill, social media giants decided to ban news content on their platforms. But PIA can protect your ability to consume the news and content you love. Private Internet Access is available for Windows users, Mac OS, Android, Linux, iOS, and you can use one PIA subscription to protect an unlimited amount of devices. And we've got a huge GB News discount for you too. Click the link in this video's description and you'll get a massive 83% off PIA. That's under £2 a month, the price of a coffee, and you'll get an extra 4 months completely free on top. Also, there's a 30-day money-back guarantee too. Visit piavpn.com/GB News to start protecting yourself digitally today.
Yes.
Basically.
Yes.
It's that simple. That's how it works in other countries.
Yes, and it's bizarre because, let's get back to other, manifesto commitments that even were pledged. The Tories obviously got totally wiped out in the last election, quite rightly so. But as part of their manifesto, they were implementing a £5 charge for a GP appointment. Now that caused debate, rightly so, because people thought that actually there might be too many people using the NHS when they shouldn't be in the first place, or people are abusing the NHS. And, of course, there's only finite resources, there's only so many doctors, and all of a sudden we've got all this backlog of terms of hospital appointments and all kinds of appointments that need to take place. So should you have a charge? That's a legitimate question. But that's just within people in the UK. Of course, if you're coming from abroad and you're using what is a health facility, something that is built on taxpayers' money, that is there for people in the UK at the free of the point of use, if that's going to be abused, or if it's going to be used, just like we would go to any other country, we would be charged. So, of course, people that come to the UK should pay the bill.
Is it time, and I know a lot of people don't like it, but is it time we had some sort of ID card, national identity card, so that, wherever you go for stuff like this, your card gets swiped, they know who you are, they know what you're entitled to?
Well, that ties into the question of should it be an insurance-based health system that we have? Because part of your national insurance or an ID card will be linked to an insurance-based policy, so an insurance-based number, like if you get car insurance or if you take out a car just for whatever, you'll get a policy number on that insurance. Of course, people don't want to go down that route, understandably, because we want the NHS to be free at the point of use, because it is the bedrock of one of our basic principles. If you get sick, if you get ill, you should be able to have that health care, because health is the most important thing. But when it's abused, but it's currently being abused by people in the UK as well.
Well, of course, yes.
There are too many people that I think that do go to the NHS, that turn up at A&E as a first port of call rather than a last resort, which is what it's there for. And that's why you have the backlog, I think, on too many occasions. And then on top of that, if you've got people from all over the world just coming to use a hospital or get treatment and not being billed for it, that's why there's so many deaths. That's why so much money is pumped into the service. But we don't see the results here in the UK.
And to be fair, Charlie, a lot of people go to A&E these days because they can't get to see their GP.
Well,
and you get desperate, and you can't get through on a phone line, or when you do get through on a phone line, the advice is so ridiculous. So you end up going to A&E. You can't help it.
Yeah, totally. No, I totally accept that, and I think that's part of the problem with GPs being overloaded, but they're overloaded by people who have missed appointments. So there is a question then about, do you charge people for appointments so that they don't miss them in the first place, to make sure that then people don't end up going to A&E when they should just be seeing a GP. But the idea that on top of that you've got people from abroad that just turn up and present themselves at hospital for minor ailments or ointments that need treating, but yet they are not paying a single dime to what is a national health service for UK taxpayers and British people.
So the problem,
I think is absurd.
The problem you've got, just very quickly on this one, is my friend's a nurse in a big London hospital, and she goes, what happens, because I had this conversation before, what happens, she goes, if you've got a pregnant woman turn up, literally giving birth? You say, I'm sorry, unless you hand over your credit card, we can't treat you. You're not a resident, you are clearly you can't turn people away who are literally in dire help of need.
Totally, and that's the problem. So, of course, if you do turn up at an NHS, whether it's a hospital, whether it's any kind of clinic or a GP, so you will be treated. And that's the bedrock. But it's making sure that you then bill people if they're not from the UK afterwards. So the billing should come obviously after the treatment. But the idea that there seems to be an open door policy, that we are a soft touch. So whether you're coming on a small boat, you get a hotel, you're able to be a Deliveroo driver or any other kind of food delivery app driver, that you're able to work, that you're able to get a hotel, you're able to get £50 a week on benefits, you're able to live in the UK and have a great time, as well as use the NHS. That is a pull factor. That's why so many people come here illegally, which needs to be stopped. But it's the same token as why people come here to use the NHS, because they think, and clearly, as the report suggests, that they're not going to have to pay for it.
Yeah. All right, Charlie.
Thanks
very much indeed. Well, a spokesperson for the Department of Health said just as Brits abroad have to pay for healthcare, so should visitors to this country. Last year, the NHS identified and recovered payments from more overseas visitors than in any previous year since records began.
Meanwhile, an NHS spokesman said the NHS is committed to delivering the best possible value for taxpayers' money. If a patient needs non-urgent care, full payment must be secured in advance of treatment being given, and only when treatment is deemed urgent or immediately necessary should it be provided in that place.